welcome back to another episode of our podcast, Nothing in My Brain. I'm Joey.
And I'm Olivia.
And today we're going to be talking about neurodivergence.
Yeah. And so we're going to go over the different conditions and what neurodiversity is. So first, neurodiversity is the concept that everyone's brains work differently. And so there's a variety of ways in which our brains process information, and there isn't a right way. And this term was first coined by sociologist Judy Singer in 1997, and this launched this disability and social movement for autistic individuals. And interestingly, she models this term off of biodiversity. And she made this interesting analogy, which is that if biodiversity is essential for an ecosystem's stability, then isn't neurodiversity essential for cultural stability? And so she's just trying to frame it in a way that these variations aren't bad or a problem, but that neurodiverse individuals also have their unique strengths. And then this also aligns with the social model of disability, which says that people are disabled more by the barriers in society than their traits. And so advocates want to remove these barriers and stop discrimination around these conditions. And so neurodiversity is an umbrella term that includes two categories. So there are people that are neurotypical, who process information in a standard way, and then people who are neurodivergent, whose brain function is different than what is considered typical. And so about 15 to 20% of the world's population shows signs of neurodivergence, and there are common conditions that fall under neurodivergence, and we'll be discussing some of them today. So the first one is autism spectrum disorder. And as we all know, autism is a spectrum, but it's not like a linear spectrum of, not autistic to very autistic. It's more like people differ in which autistic traits they have. So it's kind of like a set of sliders. And so two people with autism will experience it differently. For example, one person might be more sensitive to loud noise, or one person might have more trouble making eye contact. And so previously autism had many subtypes like Asperger's, but now they all fall under autism spectrum disorder, which is this developmental disability that includes challenges with social skills, behavior, and communication. So signs of autism usually manifest within the first 3 years of a child's life. And so some social symptoms include problem making eye contact or making friends and interacting with others, and they also may keep to their own bubble, and they may not develop a theory of mind. So they have difficulty with reading facial expressions or others' feelings. And then some behavioral symptoms include repetitive movements such as flapping hands, unusual or stiff body behavior, and they may be sensitive to certain sounds or textures. And they're very insistent on repetitive routines or rituals. And then as for communication problems, it's hard for people with autism to communicate with others, and they start speaking at a later age, and they have delayed language skills. And so children often have a lot of difficulty navigating the world at an early age, and especially when they enter adolescence, it can be even harder because they're trying to fit in with the group and like school and all that. There's social rejection. And then even in adulthood where you're in the workforce, it's also very difficult to navigate. And autism spectrum disorder is 4 times more likely to occur in boys than girls, and it does tend to run in the family. And so, yeah.
So for children, usually if you want to have a diagnosis for children, there's something called the modified checklist for autism in toddlers. So this is a screening test for parents. It's not like a diagnosis per se, but it's sort of like a way for the parents to confirm their suspicions and then bring them to a psychologist or things like that. And also when you talk about how boys are more likely to be diagnosed than girls, it's actually because a lot of these tests are based off of this white male centric population, so it might be more biased or skewed to like boys rather than girls. So it's more of like less of like they're more likely to be diagnosed with autism and more of like an underrepresentation of girls.
Oh, okay. What you brought up was really interesting. And this is kind of related, but about like the test when you're diagnosing these disorders, they can also vary from culture to culture. So if you're in, for example, like Asian culture versus Western culture, let's say you're diagnosing autism. Well, in Asian culture, it's considered rude to make eye contact with adults or people of authority. And so, but in Western culture, not making eye contact is one of like the symptoms of autism spectrum disorder.
Oh yeah, and like some like autistic individuals like they mask like their symptoms, right?
Mhm.
So like they sometimes like they want to fit in with like this like society, and so they
Yeah.
like sort of hide like their more apparent symptoms. Like they make themselves make eye contact when they know that it's socially acceptable to do so, and so this masking sort of helps like it hinders like the ability for them to be diagnosed, because you're like, oh, like you appear like normal, but it's like they're masking their autistic symptoms.
So would that be a harmful thing in the long run because
I mean, yeah, because like they're not like showing like their like neurodivergence out, so people just like assume like they sort of like hide like their symptoms like fit in, so that's bad.
Oh yeah, especially because they don't have the proper diagnoses, so then
Yeah.
they might not understand why they're struggling sometimes.
Yeah.
And so yeah, it is shaped a lot by like the cultural norms around you and stuff. And so some genetic factors, or autism is related to certain genetic conditions, and one of them is Fragile X, and this is an inherited condition caused by a mutation on the FMR1 gene, and it causes intellectual disability. And another genetic condition it's related to is tuberous sclerosis, and this causes non-cancerous tumors to grow in the brain. And another one is Rett syndrome. So this occurs mainly in females, and this is a mutation on the MECP2 gene, and it causes intellectual disability and loss of motor skills. And then I guess there are also environmental factors, or mainly factors that have to do with the mother. So if the parent is older, or if the mother has conditions such as like diabetes, stuff like that.
So if you like suspect that you or like someone you know has like autism, there's a couple of ways for you to like get like a diagnosis. So first, if you suspect that you have like autism, you can take the autism self-quotient test. So this is a self-report test which measures autistic trait, and it's not diagnostic, but it's more of like a screening like tool for adults. And if you like want to have like an official diagnosis, there's like this standard clinical tool called the autism diagnostic observation schedule, which is like a way for like psychologists to like observe a person's behaviors and like responses in a structured environment when they're doing like structured tasks. So they're looking for like their communication skills, their social interactions with other people, and their general behavior. And this is sort of just a way to have like an official diagnosis by like a clinician.
So is a checklist something you can take online, or is it
Yeah,
on
it's
paper?
it's a checklist. It's a test. Basically, they like ask questions and you like report like what you think the answers are, and then
Oh, but it's not an official diagnosis.
it's just a screening thing. Yeah.
Mhm. But autism is usually diagnosed early on in a child's life, right? And so
Yeah, that means like that's like it's like a spectrum, you know what I'm saying? So if it's
Yeah.
like super like if like your symptoms are like super apparent, then like obviously you're gonna be diagnosed like really early.
Mhm.
But if like your symptoms are just like either like you mask it or like it's not like
yeah.
super like apparent, then obviously you're gonna be diagnosed like either later in life or like especially like if you're a girl, then like you might not be diagnosed at all.
Oh, okay, that's really true. And so there are also like certain treatments for autism and certain like therapies for people. And one of like a behavioral approach that is widely accepted is applied behavior analysis. And there are basically like two styles of this behavioral approach, and one of them is discrete trial training. And this basically breaks down behaviors into small steps, and it builds up to an overall desired behavior. And so there are basically multiple trials, and in each one, desired behaviors are encouraged through reward, and undesired behavior is discouraged. So for example, let's say you want to teach a child how to behave at lunchtime. Then you break it down into these individual skills of getting in line, or like standing, holding your tray, finding a place to sit, cleaning up afterwards, and recognizing the lunch bell. And then another style involves pivotal response training, and this is mainly for young children, and it takes place in a natural setting. And so this can be in like your backyard, at your home, so it's not in a clinic or anything. And it's very play-based, and they basically try to reinforce targeted skills through natural interactions between a mother and the child. And then there are also developmental approaches. So speech and language therapy is common, and there are also psychological approaches to help people with autism cope with anxiety or mental health struggles, because those often coincide. And so things like cognitive behavioral therapy are really effective for changing one's mindset.
Yeah. Okay, so for the next like neurodivergent like disorder that we have, it's ADHD, which
stands for attention deficit hyperactivity disorder.
Yep.
And so this is a disorder marked by trouble with attention or hyperactivity and impulsivity. And then there are basically 3 types of ADHD. There is the inattentive type, the hyperactive and impulsive type, and then the combined, which is both of them. And so basically in people with ADHD, there is a dysregulation of the executive function system, and then this system allows us basically to plan, prioritize, and work towards a certain goal, as well as ignore any distractions. And so that's why people with ADHD might have trouble with hyperactivity or attention and stuff. So hyperactivity can manifest in ways such as like fidgeting excessively, talking a lot. They have a hard time staying still. And although it might not manifest outwardly, for example, they might appear calm on the outside, their brain might be racing and bouncing around all these different ideas and stuff like that. Okay, so although ADHD is called attention deficit disorder, it's actually has to do with trouble regulating attention. And so people with ADHD, their brains are easily distracted, and so they jump around from one thing to the next, or they hyper-focus, which is when you zone in on one thing. And then a funny thing, like an interesting comment I saw was that people said having ADHD is like having a bunch of tabs open, but you don't know where the music is playing from. And so another symptom is impulsivity. And so impulsivity can manifest in interrupting others or having poor organization and study skills. And so ADHD is often first identified in school-aged children who have trouble in the classroom, and it does persist until adulthood. And so I think it's a really common experience for people with ADHD to be accused of being like lazy or irresponsible, but often individuals with ADHD, they feel like they're at war with themselves. For example, they know they have to do the task, like doing the dishes, but it's really hard to bring yourself to actually do it. So yeah.
Yeah, so since like a lot of like the first like warning signs that someone has ADHD is like when they're in school, so like they're not performing as well. There's this thing called the Vanderbilt Assessment Scale, which is for children, and it's typically like completed by like the parents and the teachers because it focuses on their inattention, their hyperactivity, and their performance in school. So this is like an early way for like the child and like their like parents and educators to sort of know that like what explains like their behavior in school.
Mm-hmm. And then there's also like later tests.
Yeah, so like there's like this thing called the Conners rating scale. So this is for both children and adult, and this measures just like your behavioral like symptoms of ADHD. So yeah. Mm-hmm. And then there's also like the adult ADHD self-report scale, and this is also like a screening thing. So it's basically just like a self-report questionnaire that is like developed by the WHO, like the World Health Organization,
mm-hmm.
and this helps people identify like what the symptoms of ADHD are in themselves.
Oh, okay. And there's also like, as for causes of ADHD, there's some evidence that shows it's genetic, but there's no specific genes linked to it. But people with ADHD do have low levels of dopamine or norepinephrine, which are these neurotransmitters. And also brain metabolism is lower in parts of the brain that control attention, social judgment, and movement, which makes sense. And so some different brain networks involved are the default mode network, and these are a group of brain regions that are more active when the brain is at rest, and it's less active when a person is engaged with a task. And so people with ADHD have atypical connectivity in this region of the brain, and so it's associated with being easily distracted. And then they also have lower activity in cognitive and attention networks, and abnormal connectivity in the reward system, which basically has our dopamine pathways. And so this may cause people to prioritize short-term rewards over long-term, and it affects like that planning or prioritizing part. And so as for treatments for ADHD, there's medications, and so stimulants are very common. Like, for example, there's medications such as amphetamine or methylphenidate, and I think they have something to do with increasing like the dopamine. And there are also antidepressants used, but stimulants are like the main one. And then there's also psychotherapies, so this can be like CBT or DBT to help you change thinking patterns and to help boost your self-esteem. And so if you do have ADHD, I heard that it's very helpful if you have routines to stick to, and you like make note of all your appointments or your plans and have kind of a set of these are my tasks to do for the day, so you know what to prioritize. And also if you have like large complex tasks, breaking them into small manageable steps really helps.
Okay, so like having a diagnosis for like these disorders are really helpful because it helps like individuals identify like what they need support with, and also people can receive accommodations for their like neurodivergence in like school settings or like work settings. And also it like validates people because like they understand like what their symptoms are attributed to, and it helps them like work like and combat it with like treatments and things like that. But we talked about this before, but there's like cultural biases towards these diagnoses. So like since these are all like developed or like researched in like predominantly like Western countries with like white male like populations, it's sort of like skewed towards that like demographic, and then like in like Asian like countries, like they are like less likely to diagnose people with this disorder, and like therefore they don't have as much like treatments for these people, accommodations. And you know that like girls and people of color are like less are like underdiagnosed with these disorders just because like there aren't like a lot of research on these populations. And then masking also affects diagnosing these people, which we talked about.
I think like I saw somewhere that like autism is like as you said, it's underdiagnosed in Asian or like African populations, and then it's and then I think I'm not sure if it's autism or a different neurodivergent disorder, but it was overdiagnosed in people that were of like I think it's like mixed or Caribbean origin. So there's that. And then also what you said about the diagnoses is really important, because I saw a lot of people say that, oh, it kind of like lifts a weight off your shoulders, because you might be like, oh, why am I struggling? Why am I so behind? Everyone else seems to be doing just fine, but I'm having a lot of trouble at school and doing tests. And so having that kind of label can relieve some of the burden, and it can help others understand you and know what to do to help you and accommodate to your needs, kind of.
Yeah, so like when you said about like feeling like more like enlightened about their conditions, like that's like some people like they feel empowered because they're like, oh, like I'm not worse than other people, but like I'm just like different. But also like on the flip side, like people sometimes they feel limited because like once they're diagnosed, they're like, oh, like I'm like limited in like life because like I have this disorder that like I have to like combat with. So they feel only seen through this diagnosis because they feel like people will just seem to like, oh you have autism, like I only see you like in a certain like viewpoint, and so they feel limited in this way.
Oh yeah, that's kind of like related to what I was saying before about the social model of disability, how it's more like a mental barrier rather than the actual like barrier of the disability you have. And so a lot of the times it's because society kind of has this, there's like the stigma around these conditions, right? So they're seen as kind of like a curse. And so because of that, you believe you're incompetent, you're inferior to other people. And yeah, that's really damaging to your self-esteem, and it can really hinder like your growth ability.
Yeah, some like social like stereotypes, I feel like especially with like conditions like ADHD and like autism, I feel like boys are more like seen as this like hyperactive like people, and so like when they are like really like hyper, like people are less often to like see that like, oh, you have like ADHD or things like that, and it's more like, oh, like you're just like being like a child and things. So it's like it's harder for people to like understand that like maybe they have this disorder if they're like expected to like act a certain way.
Yeah, that's true. And especially with the way these disorders are portrayed in the media. I mean, there are like more accurate representations and then more inaccurate. So, for example, one that comes to mind is the Maddie Ziegler. How she was, have you seen it? Oh, she was basically, Sia cast her to play an autistic teenage girl in her music video, but obviously Maddie Ziegler is neurotypical, and so there was a lot of backlash over it, and especially I think with the way they represented the autistic community, people were saying it wasn't really accurate. But then there's also like this K-drama. I was actually going to watch it, and I haven't gotten around to watching it yet, but it's viral, so I will say that. Extraordinary Attorney Woo, I think that's what it's called. And so the main female character, she's autistic, and it's really interesting actually because it has a very accurate representation, and a lot of people were saying, oh, they felt seen after watching it because, yeah, it was really like relatable for them.
Okay, oh yeah, I want to talk about this, but it's like these disorders sometimes they have like narrow definitions, right? It's like if you have ADHD, like you're like this like super like hyper, like you can't like sit still and things like that. And if you're like autism, you're like this like really like quiet person who's like there's this specific like taste and like this specific like behavior, and so like this sort of like limits like the scope of like people understanding your disorder. I know that some like autistic people like they either mask it or like they aren't like their symptoms aren't like as like typical as like what people would expect them to be, and they like don't feel validated by other people because they're like, oh, I have autism. They're like, but you don't look like that. So it's like these like narrow like definitions, like they don't really like validate like people who are on the spectrum, because it's like a spectrum again, as you said.
Yeah, exactly.
Yeah.
Wait, that's actually really bad because you feel like, oh, you don't fit in. You don't fit the criteria. It's not like a checklist that you have to check off.
Yeah, it's like if you are, then you are, and you should be allowed to feel like you're validated with like your diagnosis.
Yeah, but that's true. But it's also really important because nowadays there's kind of I don't want to say there's an overdiagnosis, but I mean when people self-diagnose, some people like self-proclaim.
Yeah, I want to talk about this. So it's like right now, like especially with like TikTok and like social media, that there's like this like trend of like online testing and like TikTok diagnoses. So it's like, oh, like if you do this, you might be autistic.
Exactly.
And like this like, although like this like leads to like an increased like awareness about like these like neurodivergent like things, but like it like also like opens access to like marginalized people, so like people who don't have like the ability to like access to like these sort of like tests or things like that. Like they sort of feel like there's this awareness to that like they might possibly like have like this like autism or ADHD, but then also like there's also like this overgeneralization. So it's like if you like can't sit still, if you like fiddle with your thumbs, like you have ADHD. Like it also like spreads misinformation around. It's like people who aren't like qualified or like based on their own experience only, like they like generalize like their diagnosis to like everyone online.
That's true.
And also like trivializes like the disease. You know what I'm saying? It's like if it's like so like common, then like it is what it is.
Wait, that low-key reminds me of like people try to make their diseases, I don't want to say they're romanticizing it, but they try to make it seem like a silly thing. Like
Yeah.
this silly, sometimes they make it seem like a very silly or quirky thing. They're like, oh, it's just my ADHD brain acting up or something like
and
that.
not to say that like that is like not like an important like condition to like when you have like
Yeah.
this is important, but like it, you also need like treatment and things like that. It's like it's not
Yeah.
like
I think it's
okay.
definitely like it's definitely very serious and it shouldn't be taken super lighthearted.
Yeah.
But again, humor does help like
Yeah.
accessibility around it at the same time.
Yeah, okay. So thanks for listening. This is it for now. Don't
Yeah.
forget to follow us on Instagram, TikTok, Spotify, YouTube, and we'll see you next time.
Yeah, and then we're going to be continuing our discussion of other conditions
In the
that
next
fall
episode.
under neurodivergence.
Yeah.
Yeah. Okay.
Bye.
Bye.